We're going live. Not all of you come in at once. So as you trickle in, I want to welcome you to a very important and what is going to be a very well-attended webinar on a subject that's incredibly important and very hard to find resources on, which is how interpreters can work effectively in teams with speech language pathologists in educational and medical and social services settings. And we are delighted to welcome you to our presenter, Henriette Langdon. I will have more to say about her in a moment. I just want to let you know a couple of things. First of all, we are CCC. I am Marjorie, and CCC is Cross-Cultural Communications, by the way. We're the only national trading agency for community and medical interpreting. I am Marjorie Bancroft, the director and founder of CCC. And we have been hosting this very popular free webinar series that started in the early days of the pandemic a year ago, just as a sort of service to interpreters, and proved so popular and well received that we have been continuing it ever since, with a focus on remote interpreting in particular, but also in this new series, this fourth series within our webinar, our free webinar series on tools for interpreters, specific techniques and strategies on certain topics that we know have proved challenging to interpreters before and during COVID. So the idea today is, if you have ever wondered how, you know, we used to call them speech therapists, but speech language pathologists, how they work with interpreters and how interpreters work with them across language barriers and often literacy barriers and misunderstandings about what speech language pathology even is, then you know what I'm talking about. This is a very, very tricky and delicate topic, but we have an amazing expert here. This is Henriette Langdon, who has credentials more than I can name in speech language pathology as a speech language pathologist of decades, has worked extensively, not only with children and adults that she is serving, but also interpreters. And she's fascinated by the difference that working with trained interpreters makes and how important it is for accurate assessment and all the complexities of the cultural components. So before I let you go and have fun with Henriette, just a reminder that within 24 hours after the end of the recording, typically, and certainly no longer than 48 hours, you will get a link to the recording, a link also to the PowerPoint, which Henriette is generously sharing with you. She asks that you please do not share it without getting written permission first. You can just email us at info@cultureandlanguage.net. Andrew, our staff member who is kindly with us, can write that link, and we'll write it several times in the chat. Would you please also be kind enough to put your comments and welcome into the chat, greetings to each other and so forth, but questions for our wonderful presenter, if you would please put them in the Q&A feature. And only those who attend this webinar live, unfortunately, can get the CUs that we offer for this webinar. Without further ado, Henriette, I am going to pass the baton on to you. Have a wonderful time. Thank you so much for doing this.
Thank you so much for such a wonderful introduction, Marjorie. It is my real pleasure to be able to share with you what I have gathered and experienced in the last 3 decades, I have to say, while working with interpreters and also with children whose language I don't know, because I speak 4 languages, including English, but I don't speak the many other languages that we come across. So the idea of working with a trained interpreter is extremely important. I decided to call this presentation Navigating the Communication Puzzle, because it is a puzzle. And there are advantages and challenges, as you all know, of interpreters and translators collaborating with speech language pathologists. Please note that I'm using the word collaborating because I feel that we often use the term use interpreters, and it is widely used everywhere, using interpreters. But really, when you do work with the word use, it's more like a tool, and we are not a tool, we are people, and we work together in order to share, you know, the communication between two people who do not share the same language. So in my PowerPoint, I put down how you can get in touch with me, and I won't spend too much time on this. The learning objectives for today are that at the end of this webinar, you will be able to list the professional tasks that are performed by speech language pathologists. You will explain the roles and responsibilities of the SLP, which is the speech language pathologist, and interpreters, translators in these tasks. And you will be able to describe the process of collaborating between an SLP and interpreters and translators. I just thought that it would be important to begin and say that the profession of SLP exists since 1925, almost 100 years. And we work very closely with audiologists. And even though I will be talking about SLPs, some of what I'm going to say applies to audiologists as well. The profession of audiologists exists since the 40s, and both professionals belong to the American Speech Language Hearing Association, which was established, as I said, almost 100 years ago. But audiologists also belong to what is referred to as American Academy of Audiology, and that association has existed since 1988. Currently, there are 210,000 ASHA members in the US, and include some members from overseas as well, because I'm assuming that some of you are right now listening to me from some other places in the world. In order to exercise your profession as a speech language pathologist in the different settings that I will be briefly listing in a few minutes, you have to have a master's degree. It used to be that just a bachelor's degree in speech pathology would be sufficient. But about 15 years ago, this has changed. And interestingly enough, you need a doctorate in audiology. That has also changed in the last 50 years. It used to be that someone with a master's degree could practice audiology. So what is it that we as SLPs do? We identify, we assess, and we provide therapy to clients of various ages through the lifespan, 0 birth to 90, who have challenges in communication, communicating successfully because they have speech language challenges. We also draft intervention treatment plans for these clients. And the etiology of these problems might be developmental. It's something that a child has for sometimes for a reason that you may be able to explain, but sometimes you don't. And we work in different settings. We work in schools. That's the majority, a lot of about 60 to 70% of the members of American Speech Language Hearing Association work in schools. Others work in clinics. They work in hospitals. They work in rehabilitation centers. So as you see, there are variations in ages, needs, settings. So we are pretty much, we need to know the whole human being, but we specialize in a specific area. I have specialized in children from early age until age 22. And so why is it that we need to collaborate with interpreters, translators? Because in the United States alone, we have hundreds of languages that are spoken for from about 60 million individuals over the age of 5, and languages include 150 different languages, including native North American languages. And this is taken from the US Census Bureau. And of course, as you all know, in the US, the use of Spanish far exceeds the use of other languages, but there are other languages that are spoken for which there might be very few people who speak those languages. And there are, one might think, not very many, but about 10%, 9 to 10% of the population over 5 years of age report speaking English less than very well. So this is where our tasks, you know, of working together will be so important. So some other demographics in Australia, there are as many as 300 different languages. In Mexico, where I grew up, the number is, I was astonished, 292. And you can read Indonesia, other language, other countries of the world. And however, why did I speak about this proportion or number of languages? Because the survey that has been done on those who are members of ASHA indicate, believe it or not, that only 6.5% of our membership of 200,000 or so speak in other languages. And of those, there are quite a few who use interpreting, like interpreting, sign interpreting. And of those that are reporting that they provide bilingual services, 84% say that they speak Spanish, and other languages represented are 16.9, and ASHA does not specify. So that's why we need your help. We need very much to work with you. And I'm so delighted that I'm able to share this information to interpreters. And also, some of you may know that the reason why we have to work and collaborate with interpreters is because there are legal mandates in public schools and healthcare facilities. In 1975, which is a long time ago, PL 94-142 was introduced, and it stated that a student needed to be assessed in their stronger/preferred languages and or mean of communication. That may mean sign language as well, when identified as having a problem. So if I have to assess a child whose native language is not English, it is my obligation to also look into the other language. How will I do it without your collaboration? It's absolutely necessary. And by the way, this PL 94-142 was revised in 2004, and you will hear often the term IDEA, which stands for Individuals with Disability Acts. And also, in terms of rehabilitation, hospitals and medical facilities, there have been mandates that have been introduced, and those were much more recent in the year 2000. President Clinton passed an executive order, which is called Improving Access to Services for Persons with Limited English Proficiency. And I have to admit, I didn't put it here, but a survey that is fairly recent indicated that unfortunately, maybe 70% of hospitals throughout the United States are following this mandate. So your help is absolutely imminent. So how do we work together? All strategies that I will be described can be done on-site or virtually, especially now. And it is much more common to be using the services of an interpreter virtually in a medical facilities. And some of you right now in the audience probably have done it, but it can happen in any setting. What you do, what your duties are, is to conduct interviews and conferences with family members, because you need to obtain a history of health and development and information to facilitate the assessment and intervention plan. I'm sorry about the background noise. So how will you, excuse me, Millie, the interpreter will assist. In red, I wrote down what the interpreter will do to get to help out. You will be assisting the speech language pathologist in obtaining a family and background information by asking the questions directly. So it's very important that you are prepared to do this work ahead of time. The other thing that you will be doing is that you are going to be completing or helping the SLP complete a variety of assessments to gather information on that is needed. So in this vein, your role as an interpreter will be a little different, and that merits for certain a lot of more time than we can devote today. But if there are tests in any language, I have found that it is much easier for the interpreter to be trained by the SLP to administer this test in their presence, in the SLP's presence, rather than going back and forth from the English to the Spanish. And by no means should we allow to translate a test into another language, because it changes the whole thing. And we have very, very few tests that have been what they call normed on individuals who speak other languages. So you have to use other means of doing so. And this is throughout the world, and with all the immigration that we have right now, it's becoming extremely complex. My advice and that of other people is that if you don't have a test in the other language, you need to take what we call a language sample. And that is something that the interpreter will need to get to some training. So in a way, you become like an assistant to the interpreter, to the SLP. This might be a little bit of a novel and question mark question for some of you, but that's what happens. We cannot do it. You can do it. Let's say you speak Cantonese or Chinese. I could not let you, I don't have tests in Chinese, or very few, and if they are, they may not be appropriate. How will I find that the child has, the grammar and the syntax and the vocabulary and the sound system without your help? And so you can't do this at the last minute. You have to prepare for it, even more so than in other tasks that you have to do. So again, here is where the IT's role will deviate from the traditional role of an interpreter, where you have to be sure that you are interpreting and conveying the meaning from one language to the next. Now, if you work in a rehabilitation center or medical center or acute center, you will have similar responsibilities as the one that I outlined before, but you will be rather than your patients having a developmental problem, they will have it acquired, and you will have people having, loss of language due to strokes. So you might have all sorts of what we call aphasia, or you may have a patient who had an accident. So you would have traumatic brain injury. They will also have other speech difficulties, which is not pronouncing sounds clearly, and that is called apraxia and dysarthria, which means, again, implying here that as the future collaborator of an SLP, there'll be some terminology that you will need to be familiar with. And medical speech pathologists may perform very specific tests, like, for example, swallowing, or what we call dysphagia, and other kinds of tests, which is called the FEES. It's the fibroscopic endoscopic evaluation of swallowing, where you insert a small tube in the nose, and then it looks at all parts of the mouth that are involved in swallowing, including the larynx, the pharynx, and the trachea. So again, as an SLP collaborator, you are going to have to learn the terminology. And some of you who are medical interpreters, that would be maybe a little easier than some of you who work in other settings, but that's something, and to consider. In most cases, like I said before, there are no tests on bilingual students or adults for that matter. So, or various combination of languages. So other methods that you will have to do, just to summarize, will be like, and it will be something that you will need to discuss with your speech language pathologist, is an analysis of different language samples, depending on the age of the patient or client, reading and completing questions about the original language, because you may be able to get books in the patient's language, but it depends also on the patient's level of literacy. You will be, if it's a younger student or client, requesting the parents to give you a thorough developmental history, because we find that those children who have difficulty learning their primary language will very likely have difficulty learning a second language. And so again, you will be a very important part of gathering the information, transcribing, because I don't speak Cantonese. So that's why you will be asked to help the SLP to transcribe your language sample. However, don't worry, because it's not your responsibility as an interpreter translator to decide what the problem is. Your charge is to assist the SLP. You may be consulted, but you will not be charged of making the diagnosis. Collaborate, you will have to collaborate with other members, just like you do in other settings. In the school setting, it'll be teachers, psychologists, in the hospitals, occupational therapists. You will be participating in meetings that we call the IEPs or IFSPs, which are individual education plans, individual family service plans. You will collaborate in the hospital setting with different physicians, professionals who have different specialties, a variety of different therapists, social workers, family members. In both situations, the interpreter will be involved in follow-up planning, hopefully. So what are the responsibilities of speech language pathologists vis-a-vis the IT? You have to prepare before you have a meeting. Sometimes you don't, because you have no time, like if you have an emergency in a hospital, but most of the time you have to have some briefing. You have to use some very specific vocabulary. You have to if you relate to medical issues, you have to be knowledgeable about birth, early infancy, development, the history of motor and speech development. During a conference, the SLP will report the results of assessment and other goals for intervention, and this will be related to the profession. And if the patient has aphasia, they may have a loss of comprehension and or expression of speech. And during the assessment, like I said, there will be different tests, and you will need to understand how a test is built. There is a lot of things that you will have to be prepared for, but it's feasible. And what are our responsibilities towards you is training in regulating understanding regarding the acceptance and dismissal in each setting, and also the process of identifying a problem. I won't go into detail because we're running a little bit out of time, but what would we like from you as interpreter translators? We would like to work with individuals who have very high proficiency of oral and written uh, understanding of their languages for the reasons I mentioned. You have to understand and speak both languages, not only to convey the same information, but also understand the grammar, the spelling, in case you have to do a language sample. You have to, we hope that you will be able to help the SLP by being knowledgeable of two cultures, not only two cultures, but their interaction. And let's not forget the nonverbal communication. You have to be sensitive to social and cultural variations, dialectal variations, pronunciation differences, because if you speak Spanish from Argentina, it's not going to be the same Spanish as you speak in Mexico. That's just one example. And the intonation, the use of gestures, facial expressions. You must be also, sensitive to a given cultural background. A parent who has not had very much education will have maybe different questions than one that has had, more education. And also you may be confronted with difficulties from parents for accepting that their child may have a certain problem. You have to, of course, this is just in part of you to convey the same meaning in the two languages. And as you all know, variations exist across languages based on sentence level, the construction of the sentences, and some languages use sounds which do not exist in other languages. Words with the same meaning, but spoken in two different ways may be quite different in their length and speech sounds. You have to know the professional terminology. You should be familiar with the procedures. And of course, if you use a computer or dictionary, it's very important. You need to understand dialectal differences and vocabulary differences. And there is no, very important for those of us who are in speech pathology, we respect every single dialectal difference, and dialect doesn't mean that it's not a language. It might be a language as well, but it has its own form of rules of syntax and grammar. And also we need to adapt to the speech and language of the person that we're talking about. There is an art to it. You will still convey the same meaning, but in a slightly different manner. You need to be a good listener, and also the client that you will be working with might have some speech difficulties. So you have to be very careful and convey to the SLP that this particular person is not pronouncing certain words very correctly, and give examples. And you need to understand your role and your function. Yeah, you're going to say, Dr. Langdon, Henriette, how can I remain neutral? You have to be as fair as possible and accurate. And your responsibility may be redefined as your relationship develops. But you have to also follow your code of ethics, and you may not be, do a task that you are not ready to do, or you don't feel comfortable. And you all know about the different roles that has been discussed in the interpreter, such as transmitter of information or clarifier or helper. This deserves, a whole conversation and discussion, and we don't have too much time, unfortunately. You have to continue being flexible. You are going to be working with a variety of people of all ages, personalities, level of education. You should be patient and respectful. You should be flexible and to provide services with short notice and preparation time. You should respect confidentiality. When you leave the session, you should not discuss it. You should be participating in ongoing learning and also remain flexible. You should be responding positively to constructive criticism to increase success on the job. And you should continue to update your knowledge about procedures to follow. And so how can we facilitate the charge of an interpreter translator? First of all, we have to remind our SLP to avoid idiomatic expressions. We should not use idioms because it's very difficult to transmit the same meaning from one language to another. If you say, I talked her ear off, the intended meaning is often lost in literal translation. And you have to also quickly recall the meanings of what has been said. It is not up to you, the interpreter, to define professional terms. It is up to the speech language pathologist to do so. So if the term it's so frequent to use the term autism, and some cultures may not even have the equivalent of the word autism. So it is up to the SLP to explain what the terms are. It's not your role as an interpreter to do that. We use a lot of lingo and it's up to the SLP to provide, to name perhaps the process, but also give an example of auditory processing or visual motor integration. Or when you provide results of tests, you talk about percentiles. And so this is something that it is in the realm of the SLP. It's not up to you to be responsible to explain what the word means. What you do when they say percentile, it's up to the SLP to define the term, and then you can provide the meaning in the other language. To be clear, it basically is that the term should be followed by a definition or a concrete example, which is applicable to the home and work context. And the definition and examples, as I said before, this is crucial, should be provided by the SLP and not the IT. So how can we facilitate the charge of the IT? It's up to all of us to watch for indicators of translation difficulty. Like translation, I don't mean we make the differentiation between translation. But if you feel that the parent is puzzled, ask if everything is okay. But it's up to the SLP to do so. And if you notice that during the conversation, then you may interpret and you may ask permission to do so during the meeting, because after all, it's the SLP's responsibility to carry on the conversation. You are an important part of the team, but it is not your responsibility to make sure that everything is going okay. For example, if you see a puzzled expression, that may signal that what was said was too long or too complex. And very importantly is to remind everyone, we should all be mindful. I've been to so many meetings where everybody is speaking to the interpreter instead of speaking to the parent, and that it makes everybody very uncomfortable. And I have to tell you that it is very disheartening, but we don't have evidence-based practice research on what are the best measures or the best strategies to implement during a process where an IT and an SLP collaborate. And the best practices that I have found myself and others in working with interpreters and SLPs and audiologists is to maintain a continual dialogue during all the phases of the process. Also to request that SLP provide ongoing feedback to the interpreter about the participation in the process, and follow what I have baptized the bid process, like in a court case, to brief, prepare the interpreter. Don't accept a job where you don't really know what exactly you're going to do. Maybe delay the meeting, but don't rush into it just because it has to be done. It has to be done well. Also, the interaction. You saw that your role will be slightly different than in other cases where you will be more of the one doing things, but your SLP should be at your side all the time. And then don't leave the meeting without having some opportunity to go over the information that happened and all the things that transpired. And the interpreter, it's very hard for us who are bilingual to maintain our linguistic skills in the other language that we speak, because we don't get in touch as much with native speakers. But try to refine your skills, try to listen to your language, try to cultivate that. And both of us, both members of the team, should continue making effort to improve their skills. So finally, the last page I have are some references, and if you need some other references, I'll be very happy to provide these. But at the moment, I am thinking about the best way to collaborate with an interpreter and translator, and that is to have it's written in the literature, there is not very much about it, is to have meetings where both of us participate, where each one of us is trained in something that the other professional does that we may not know of. Like, for example, SLPs, and understanding what the charge of an interpreter, what the skills of an interpreter is. And then on the other hand, the interpreter understanding all of this information, that you almost become to some extent in what they call an assistant, because you have to understand what we do. You have to understand the tools that we use. You have to understand how we use them. It's not haphazard. So that's why some of us are trying to work towards a training and certificate for interpreters and translators who are working as a community interpreters, but basically working in the schools setting and in interpreting for special education, namely speech language pathologists. So thank you very much, and I am open to questions now.
Thank you so much, Dr. Langdon, Henriette. We have a ton of questions, and so I am so happy that you have time. It would be good to just stop sharing so that they can see you big up front and big if you wanted to close.
Thank you.
The PowerPoint, and as a reminder, everybody will be getting, who is attending, who is registered, in fact, will get the PowerPoint.
Would you like me to stop sharing? Will that
Yes,
help?
I mean, I'm sorry, I thought you were doing that. I can. There, perfect. Thank you. So without further ado, because we do have a lot of questions for you, I'm going to start with what, I'm sorry, did you have?
I'm trying to close the PowerPoint. I'm sorry.
No, you don't have to worry about it. You're fine. You can close it later. We don't see it anymore. We don't see it anymore, as long as you can come back to the screen and if you wish. So someone, an interpreter's reporting, I did a real 3 assessment yesterday. Is it possible for the interpreter to get a copy of it? I'm sure a lot of interpreters would like to know that about a lot of assessments.
Is it possible to get a report where an interpreter participated? Is that what you're saying? I didn't understand the question.
Someone did a REAL 3, REEL 3.
Oh, a real, that's a parent questionnaire, isn't it? It's the receptive expressive. Oh, she did that, and what would the person like?
Can they get a copy
of the real in Spanish?
Well,
I am not sure. I don't have one. I don't have that test, but if you go back to the publisher, they might have a translation. But be careful, because there are other translations. And if you are not sure what to do, just email me at that contact number, and I will try to help you.
Thank you. Next question. Are cultural factors also included in the interpreting for speech language pathologists?
It's a very good question. And it depends, because the term culture is so very, but the pictures that you use in
Henriette,
yes.
there's a problem with your microphone, and it's almost
hear
impossible
me?
to understand you.
Can you hear me?
Not correctly. Not correctly. Your microphone appears, no. You may have to take out the microphone and speak through your computer. Just unplug it.
So the question is the cultural, absolutely, because you have to take into account what the experiences of the child has been. So it depends on where you work, but sometimes you kind of develop your own cultural sensitivity unconsciously, because you've worked with the same population, so you know that if they may not be familiar with certain things, you know. But I find it, I work in a school district still, where I do assessments twice a week, and if I have a kid who doesn't identify the word palm like a palm, it makes me feel shiver, because they live in Palm Springs and there are lots of palms. So I don't understand why they may not know palm. Sorry about this. And you know, and there are things that you have to be absolutely conscious of it, because there are some kids who have never seen snow. So you have to be, especially if you live in California, unless you go to the mountains here and you see the snow, you may have never experienced it. Or if you come from Mexico and you live in Mexico, I never experienced snow until I came to the US.
Yeah, absolutely. What happens when there is no equivalent language for a term? Or
you give a definition. In English, we call it, let's say, autism. And autism means that you have difficulty communicating with another person, looking them into the eye, and you're going to say yes, but in other cultures, people don't look at the eye. But even I have talked to Asian individuals, and there are Asian individuals who have autism who don't have that, you know, looking in the eye, because not looking at the eye is a sign of respect. But we're talking beyond that. We're talking about a communication difficulty. Yeah.
And just to be clear, when you say you mean the person who provides the definition. I know this from when you were saying earlier, is you the speech language pathologist, correct?
Exactly. Not the charge. It's not up to the interpreter to do that. It's your responsibility.
Thank you. And speaking of thank you, I also want to thank you for saying at the very beginning that you don't speak about using interpreters. I have always felt that interpreters are human beings and that we shouldn't be using human beings. So special thanks for that. Next question. How long would it take training the interpreter to interpret for administering a test?
Very good question. It depends how much of it you need, but in general, you need a couple hours to gather your information, I would say on average. And then let's say 1 hour and a half, and then you need at least 1 more hour to transcribe what they said, you know, or sometimes some of us just write it down because we're used to it. We're used to taking the language from the kid, so it's easier. So ultimately, it would be great if the interpreter can get the child to say what they say and they write it as the child talks. I find what they call wordless books by Marianne Mercer and Mayer, and they are very talking about culture. It's the Frogs series of books. They have no words, and children, it's a story about frogs. I use the One Frog Too Many, and it's illustrated, and you can use it with any language, and a child can tell you a story, and you can have a narrative. It's not the perfect way, but you can get a lot of what I call juice. You can get a lot of information about how they put an idea together, the sentences, how they conjugate verbs, how they use. You can get, it's one of my tests that I use the most, you know, because even the bilinguals that I have are not perfect. No tests are perfect. You have to look at many parameters. Tests are not, this is important for our audience. Tests are only part of the whole thing. You will be extremely instrumental as an interpreter to kind of find out how the child expresses himself or herself, how, you know, the dynamics of the family, what you get from the parents is very important. Always trust your parents. I've always done it since the beginning of my career. Trust the parent. Oh, well, the parent may not have had it, but they know their kid. They know their kid if you ask the right questions. And it's up to the SLP to frame the questions, but the interpreter, because of their culture and knowledge, can also suggest some important questions to us. That's where the briefing comes in.
Yeah. Absolutely. Well, a related question from the same person is, for this training to interpret for administering tests, that's a lot of time you mentioned. Does the interpreter get compensated?
This is a very good question, and that's why they get compensated very little, because people take into consider, oh, well, speaking two languages, that's not a big deal. You know it. It's a huge deal. It's a huge deal to do the work that an interpreter does. And people in general don't understand it. And I am pessimistic in the schools. They want to pay you minimum. And knowing two languages doesn't mean that you're an effective interpreter. Knowing two languages doesn't mean that you are an effective bilingual speech-language pathologist. Many people call themselves bilingual speech-language pathologists, but it's not knowing the language only, it's knowing how to do it. How I trained myself to be a bilingual speech-language pathologist. I am archaic, I am dinosauric. I mean, I am one of the first people in the field, you know, like 45 years or so, who has, you know, trained myself to be a bilingual speech-language pathologist. And I've had the privilege of training many, many bilingual SLPs throughout my career, and love to work with interpreters and, you know more about what they do and how they are trained and how we can work together.
Yeah, it's interesting. One of the comments we just got is, I wish so many providers could have access to all this information. You mentioned earlier that some vowel sounds or consonants don't exist in the other language. What do you do in that case when the vowels or consonant doesn't exist?
In that case, you interpret how the child speaks in English in a different manner. So maybe they don't pronounce interestingly enough, the R's in Spanish are flap or trill, like those are easy examples. But if they don't pronounce certain consonants, at the end of words, it might be developmental, but may be also because of the influence of the other language. It all depends a great deal. Depends. So you have to interpret the English rendition of the language, differently. Like, for example, the sound does not exist in Polish, which I speak. So my parents, even though they were fluent in English, they always said the parent instead of the parent. The substitute the for the. So that's not a disorder. And if a child does that, children usually acquire it very quickly. But if you acquire English later in life, you have a tendency of making certain, patterns, use certain patterns. You're not, your screen. Marjorie, can you hear me? Hello? Can you hear me?
I can hear you perfectly. Yeah. Perfectly. Yes. Yes.
So that's
yes. Can you hear me?
Yes, thank you.
Okay.
Yeah, so,
can you hear me?
Yes.
Okay. Just want making sure. Thank you. We have a lot of questions about resources, vocabulary resources for interpreters, and also testing tools and procedures. Do you know this?
Yes. One possibility without reinventing the wheel is, I'm not promoting the book that I wrote with my friend, but it has a lot of good information. And it does include a vocabulary test, but vocabulary that an interpreter may need to have when they work with an SLP. And I'm revising that vocabulary a little bit. So, but the book is a good resource. The one that I mentioned, the 2016, the collaborating, the one with science. It has a lot of good procedures, and it gives you some ideas as to what to do and your role is when you do have tests and when you don't have a test, like I mentioned right now. That would be the best way to go to begin with.
Thank you. Thank you. Someone else is asking how medical interpreters, but it could be other interpreters too, how to find opportunities to work and collaborate with speech language pathologists.
Very good point, because I'm trying to find research that talks about the interpreter and the medical SLP, and I'm having a very hard time finding things. Very hard. I don't know, there's very little research on it. There is the latest article, I found it from 2019, and believe it or not, it was published in Australia, and they talked about the collaboration between interpreters, not medical interpreters, but interpreters. And I think they were not medical, and there were only 10 studies that the authors found amongst hundreds that really met their criteria. And the studies that had been done had been conducted primarily in Australia. In the US, there were a couple. These were with adults, who had strokes and apraxia, and how they had collaborated with interpreters to work with those individuals. So there is very, very little. And in our field, mostly it's complaints that neither party is well prepared, that interpreters, that the SLPs don't know if they can trust the interpreters, and vice versa. And the best way to work on this is to have a collaborative, like I said, a program where you get a certificate, where you get just like a medical interpreter. And what is interesting, and I would like to also hear your opinion, Marjorie, for medical interpreters, I do not believe that there is a section where they are trained to work with it's amazing to me, audiologists and speech pathologists. They are trained to work with the internal medicine, with gynecology, with pediatrics, with ENT. ENT, I believe, I'm not sure, because that would be the closest for an audiologist, but not speech pathologists and audiologists. So maybe that should be added to the training of the interpreter in the medical setting.
You're raising a hot button question right now, an important one, actually, because the basic entry level to the profession for training is considered 40 hours in this country. It's much higher in my native Canada and in some other countries, but 40 hours is not enough time to teach such important things that need to be taught. So there is a big push to try and increase that minimum, which is the minimum number of hours to apply for both our national medical interpreter certification programs in the US. Hopefully that will change, but keep raising your voice. But the next question is also relevant, and I'm scared to ask it. What kind of training does the speech language pathologist go through to work with interpreters?
Very little. If you
That's
went to San Jose State University, I'm very proud to say I'm going to, for once in my life, brag. If you were a student during the almost 20 years I was there, full time, you did. You did, because there was Henriette there. And somewhere else, I am not sure. You do, but I've offered many trainings in California and also throughout the nation over time. And where is the psychologist? Because the psychologist should also be working with an interpreter. And how about the resource specialists that we call them here in California? That is your special education teacher. So right now, I'm just saying SLP. Let's start with that, because that's a big one.
It's huge, absolutely.
And we have the medical and the educational,
Yes, two
which are
huge
different,
areas.
quite different.
Absolutely. Someone else is writing, I have not had the speech language pathologist give me navigating duties, only interpreting. They were not trained in San Jose, clearly. How can the interpreter let the speech language pathologist know or affirm the interpreter's responsibilities? Do you have a mini script that you can suggest? Thank you, says this person.
Not really. I think that they should say, I had the opportunity to attend a workshop, and it's very important that we work together. And would you mind giving me instructions as to what I need to do? Because I am not very, I need to be prepared, and may you be open to my suggestions as to how to accomplish that. And the problem is, Marjorie, is that oftentimes in the schools, you get to work with different interpreters. It's not always the same person. And that's what, because it's not considered a profession as such. It's terrible. It's just so unjust. We talk a lot. I talk a lot about it in the book. You were talking about compensation. They say, oh, this is not an important thing. It's an auxiliary kind of job, but it's not, because it can cause so many problems. Especially there was not very much research in speech, but medical, yes. And if you don't work with a trained medical interpreter, there can be a lot of difficulties if you do like what they call ad hoc interpreters, who are just called at the last minute volunteers or something.
Yeah,
they have found a lot of liability, including repeated. There is research on that, and I do document it somewhere, where they are, because of untrained interpreters, there were misunderstandings, and the patients keep coming back to the hospital and or have more difficulties than they should. And in some cases, that may be even causing death. And sometimes, no offense to medical doctors, they say that they speak the language, whatever it is, and they don't. And there has been surgeries to the wrong side of the, because of that. Just so simple, right versus left hand, or not many, but there have been difficulties because they didn't know what side of the body to fix.
I have to thank you from the heart for everything you have just said in support of interpreters now and throughout the webinar, actually. I wish, Ariel, you could have seen all the incredible feedback and thanks and appreciation in the chat for the quality of the presentation and the value of the information you've given. Even sometimes people said, I've never interpreted for speech language pathologists, but I really learned a lot. The sum of it up is from Cecilia's reports, Dr. Langdon, we need more speech language pathologists like you who value the work we interpreters do.
Oh,
Thank you.
Do, and I am thrilled, and I want to thank you for being the conveyor, really, of this collaboration, because I've never had the privilege of being able to speak to so many interpreters. I mean, how many? 200 or hundreds of them. And I love the work that you do, because
almost 500.
I mean, it is amazing the work that you do. I am so appreciative, because I am terribly biased. I grew up being bilingual in Mexico. I love languages. I value different cultures, and I feel that the work that you do as interpreters is absolutely phenomenal, and other people should know it. And I mean, not interpreter only in the courts and in the medical field or international interpreters. The work that people do there is amazing, but also on an everyday basis, basic level of health and well-being.
Well, thank you so much for that recognition and for the gift that you have given the almost 500 interpreters attending live, the total of about 800 who registered, who will get access to the recording. But we also, as you know, put it on our website. So many more interpreters who find out about it later will get to view this and learn from you, your experience, your wisdom, and the incredibly generous gift of your time and expertise that you've shared with us today.
It's my
Thank
pleasure.
you.
And I want everyone to know that they are very free to email me, and I will do it as fast as I can. And it was an absolutely honor and pleasure to be here today, Marjorie. Thank you. Thank you, Andrew, for the, I'm sorry about the microphone.
Oh, not to worry, not to worry. I think people could hear you clearly at the end through the computer. Please not to worry. Ariel, have a wonderful rest of your day and week. And to the rest of you, if you have questions, you can send them to info@cultureandlanguage.net. You had so many that, of course, we couldn't ask them all, but it just shows the hunger for information that you have provided today. Thank you again.
Merci beaucoup.
C'est nous qui vous remercions.
Dziękuję. Muchas gracias.
Take care. Bye-bye.